Okay, now urine volume. Okay, so normally we make between 1 to 2 liters of urine a day. Polyuria is excessive urination, so greater than 2 liters a day. Oliguria means you are not making enough urine, so less than 500 milliliters a day, so a half a liter. And then anuria would be when you're in kidney failure, so you're making 0 to 100 milliliters a day. So oliguria could mean that you're not getting enough to drink. Polyuria could mean you have diabetes. Okay, so why isn't the thing going? Okay, so diabetes is called, it's considered chronic polyuria of metabolic origin. Okay, so what's happening is you have too much sugar in your urine and the water follows it. Okay, so that leads to chronic polyuria. Now, there's 5 different kinds of diabetes. Okay, so let's talk about 5 of them. Okay, so if you have hyperglycemia, okay, which would be high blood sugar and glucose in your urine, okay, that could indicate that you have diabetes mellitus type 1 or type 2. Okay, so type 1 is what they used to call juvenile diabetes or non-insulin dependent diabetes. No, it would be insulin dependent diabetes. Okay, so your pancreas isn't making insulin. Okay, type 2 is adult onset diabetes. Okay, so you're not making enough insulin. Okay, so you end up with too much sugar in your blood, and as a result of having too much sugar in your blood, you have too much sugar in your urine. Okay, now if you have hyperglycemia and glucosuria and you're pregnant, okay, that could mean that you have diabetes, gestational diabetes. Okay, so it's diabetes of pregnancy. Usually after you have the baby, it goes away. Everything goes back to normal. The only thing they worry about with it is if it's not treated when you're pregnant, it can lead to a really big baby. Okay, now there's another kind of diabetes, which is called, I guess there's only 4 types, okay, is called diabetes insipidus. Okay, and so you don't have high blood sugar or high sugar in your urine, but you have excessive urination. So what happens is with these people is they don't make ADH. They don't make enough antidiuretic hormone. So they can't reabsorb water. So they just urinate like crazy. Like they urinate like 20 liters a day. And it leads to dehydration. Okay, now we talk about diuretics. Okay, so diuretics are things that are going to increase urine output. They're used to treat high blood pressure. Okay, so they're used to treat high blood pressure. So what we're trying to do is we're trying to increase your urine output. If we increase your urine output, we decrease your blood volume. Okay, so it'll treat things like it helps with kidney failure, congestive heart failure, high blood pressure. Okay, so they work a couple different ways. So they can make you secrete more urine. They could decrease, they can increase your glomerular filtration rate. They can decrease the amount of urine you reabsorb. So there's a couple different kinds. So LASIK is one that you guys have probably heard of. Another one is HCTZ. Okay, now how do we pee? So here's what the bladder looks like. This is the female urethra. Okay, so the bladder has 3 layers. Okay, so here's the bladder. Okay, here's where the ureters come in. The ureters kind of come in the posterior side of it. Okay, it has this muscle called the detrusor muscle. Okay, it's got a little triangle in here called the trigone. This is where the ureters come in. Okay, there's 2 sphincters. Okay, so a sphincter is just a round muscle that's going to regulate movement of something through an opening. So here's the internal urethral sphincter and an external sphincter. Okay, so I have these all listed. Okay, so there's 3 layers of the bladder. There's a peritoneum, there's a muscularis, which is smooth muscle. Okay, so we're not thinking about it, it's involuntary. Okay, and then it has a mucosa. Okay, and the mucosa layer is just the inner layer. And it's made of cells that are called transitional cells. So transitional cells can stretch. The trigone area, when it contracts, it's going to cause us to urinate. So micturition is the word for urinate. So urination, micturition are the same thing. The bladder has wrinkles in it. The wrinkles are called rugae. When your bladder's empty, it's really wrinkled, but when it fills up, they stretch. So the wrinkles allow it to stretch. So normally the bladder holds between 500 and 800 milliliters. Okay, so I just went over this. So the urethra, like 2 inches long, 3 inches long in a female. The external orifice is going to the outside. The internal sphincter is involuntary. Okay, so we don't think about that. It's smooth muscle. The external is skeletal muscle, so we can control it. Okay, the male urethra is longer because of the penis. Okay, so here's the internal sphincter. There's the external. Okay, this is called, their urethra actually has 3 parts. Male urethra has 3 parts. So here's the prostatic urethra. Okay, here's the membranous urethra. And then this is the spongy urethra. Okay, now I need to, so whenever your bladder gets full, it's going to send a signal to your spinal cord, and it's going to cause this internal urethra to relax. Okay, after you're potty trained, okay, you have control over this external urethra. So what happens is when it's the time and the place, you relax this. Okay, when you relax this external one, then the urine will come out. Okay, so the bladder starts to get full. It senses that it's going to get full, that it's full. It sends a message, relaxes this internal sphincter. Then we'll relax the external one if it's the time and the place. Okay, and then we urinate. Okay, now here's some disorders of urine release. Okay, so urinary incontinence. So there's several different kinds. So one is called stress incontinence. So this is when you exert pressure on your bladder, like when you cough or you sneeze or run or something like that. The sphincter muscles are weakened lots of times in women after childbirth. So that muscle's weakened, so anytime you put pressure on it, urine leaks out. So you have to retrain the muscles, and you just have to go to the bathroom more often so that it doesn't happen. Okay, now another kind of incontinence is called urge incontinence. So this is almost like a short circuit where you suddenly get an intense urge to urinate, and then you urinate. You don't do it on purpose. Okay, and this can be treated by medication. Okay, and then there's overflow incontinence. Okay, and this happens sometimes when the men have prostate problems, so they can't completely empty their bladder. And when you can't completely empty the bladder, then sometimes urine will leak out. Okay, and then the last kind is called functional incontinence. And functional incontinence means you can't control your body function. So you've lost the ability to control that external sphincter. Okay, now incontinence, what can it lead to? Okay, what can cause it rather? Okay, so prostate issues, prostate problems can cause it. So if your prostate's enlarged, the prostate, this is the prostate gland right here, it actually is all the way around the urethra. So if that prostate gets enlarged, it can squeeze and constrict, make that urethra really small, so it's hard to get the urine out. Okay, so it can block the ureter, or the urethra, I should say urethra, or it could damage the nerves that allow you to control it. Okay, pregnancy, just the pressure of the baby. In a female, I should have a picture, but in a female, the uterus sits like right on top of the bladder. And as the baby gets bigger, it's pushing down and it's making this smaller. So it's putting pressure on it. Alcohol can cause loss of control. Urinary tract infections or constipation can cause problems. Okay, so this last thing is depends are our friends. Okay, so before depends were around, it was normal if you couldn't control yourself and you didn't have anybody to take care of you. It was normal for people to be put in nursing care facilities just because they had incontinence problems. So depends give a lot of older people more freedom. Okay, then here's the points to ponder. Okay, so micturition. I hope I went over that enough.